Hi guys. All right. So yesterday I had my pre-op, 2 pre-ops. Okay. So I'm going to get my port in on the 16th. So in like 10 days, because I think today's the 6th. And they gave me 2 options. One, I can go to my board certified breast surgeon who will be doing the mastectomy and everything else. But I have to do a pre-op with the hospital. I have to do a pre-op with her office. And then she does the surgery herself. Or I could go across the street to the radiologist and they could pop it in. I opted for the surgeon. I just felt like if the board certified surgeon felt these steps were necessary, then I probably did too. Also, I just want to make sure that I have a good relationship with her and that she knows who I am. I mean, we've all watched Grey's Anatomy. We've all watched The Pitt. We've all watched all of the shows. If they like you, they do better for you. Not to say that they don't do good for everybody, but they do seem to try harder for people that they really care about. So, trying to make sure I'm one of those people. Did all of that. That was all really interesting. I have to shower the night before the port placement with basically a chlorhexidine wash. No lotion, nothing. My skin is going to be so mad after all of this. And then you can't wash for 24 hours after you get it placed. So I will be clean, but I might possibly be very dry and itchy. We'll have to see. So I have to wash the night before with the chlorhexidine and then the morning of. Now, I have to be there at 6 a.m. So I will be up at 4 o'clock in the morning taking a shower with chlorhexidine's body scrub in order to be there by 6 a.m. And the procedure's not until 8 a.m. So exciting. So exciting. So that's all just for the port placement and all that kind of stuff. So that's what's happening there. They do give you a clear liquid drink that you can drink that morning before 4:15 a.m. that apparently puts some carbs and stuff in your body since you can't have anything else but water from midnight on, blah, blah, blah. So it's not general anesthesia, it's just sedation. And they go 2 inches down from your collarbone, and they're going to do it on the left side since it's my right boob that's the bad one. So it's going to go over here, and they have a little thing that you can feel it, and they have the actual device when you go to the doctor's office. I got my Missouri Valley Morgan Horse Club shirt on. So yeah, you get to feel the device, you get to touch it. It has like, a little fake skin thing that they put over it so you can feel what it's going to feel like. And I will have it in for a year. And they'll do all the chemo and everything else, but then they leave it in for a year through the surgery, through radiation, through all of that stuff. I think just in case they didn't get it all and you have to do some more. So the port will go in March 16th, and apparently it'll stay in until March 16th. That's not even what I wanted to talk to you guys about today. So that's just the port placement stuff. All right. This is what they gave me. And it is full of all of the information about all of this stuff that we're going to be doing. So much information. So I don't know how to say any of these things. These are the drugs that I'm going to be on. So I was looking at this, and I have not gotten very far into this book. Literally, I only got the first few pages. So, a lot of like, what should I tell my healthcare provider if you're allergic to it? How do I know if I'm allergic to it? I've never had it. Huh. Oh, yeah. Some of these are a lot of fun. One of the ones that I thought was super interesting is, here's a little blurb. I'm just going to read it to you. Some of the drug that you receive may be present in body fluids such as urine, stool, sweat, or vomit. Wash your hands with soap and water after touching linens or clothing that might be soiled with body waste. Caregivers should wear gloves to avoid exposure to this treatment if they assist with cleanup of body fluids, or if you require assistance with a bedpan or washing linens that may have been soiled with urine or solid waste. If you use a low-flow toilet, close the lid and flush twice to ensure all waste has been discarded. So apparently my sweat is going to be radioactive. I told my husband, we'll just set aside a laundry bag. We have the stand-up bags for my barn clothes that I sweat in, especially, after chemo for the first week. And I will wash my own clothes so nobody has to touch them or anything like that. Just leave that laundry basket alone and I'll do it myself. And I told him if he does do anything to wash his hands. And I guess it's funny, everybody's been so generous, and we raised about $10,000 in the GoFundMe, which will pay almost exactly to get the new insurance going, which is phenomenal, right? It's absolutely phenomenal. There's so many more expenses. We've already put 500 miles on the car, just going to appointments, because all of my appointments are in Fort Worth and I'm in Crescent. So every single round trip is about 40 to 50 miles. And of course, gas is through the roof, and filling the car up constantly, buying another set of sheets so we can change them frequently after chemo so that I don't contaminate anything. It's just kind of a never-ending thing. Back to this. There are many possible drug interactions. So no prescriptions, over-the-counter, or supplements unless you clear it with your doctor. Grapefruit juice, or star fruit is a no-no. Vaccinations are a no-no. All right, so then they go to the side effects. And so they start with a decrease in white blood cells, and an increase in risk, or an increase in infection risk. So they want you to wash your hands all the time, brush and floss your teeth all the time, clean any cuts right away, stay away from crowds with people that have colds or illnesses, and make sure and cook food thoroughly. I guess I didn't realize you could get an infection from food. I mean, well, okay, I might look real dumb right now. I thought salmonella and that kind of stuff was like a virus. Well, I guess that's no, I don't know. I don't know how that works. I guess I'll figure it out. Okay, second one is fatigue and decreased red blood cells. So it says plan to rest throughout the day, organize daily activities to conserve your energy, eat a well-balanced diet and drink plenty of fluids, and stand up slowly to avoid getting dizzy. Well, I have low blood pressure, not like crazy low, but a little low. So I already have to be careful when I stand up most of the time. I feel like eat a steak. Decreased platelets and increased risk of bleeding. Do not take aspirin or ibuprofen or naproxen. Use caution with sharp objects such as razors or nail cutters. Avoid activities that can cause cuts, bumps, or bruises. Brush your teeth gently with a soft toothbrush and maintain good oral hygiene. When shaving, use an electric razor instead of razor blades. If you bruise, put ice on it for 20 minutes. And if you start to bleed, press firmly on the area with a clean cloth until it stops. All right, next problem, neuropathy. May present as numbness or tingling in the fingers, hands, toes, or feet. In some cases, it may also affect muscle control or balance. Stay out of the cold or extreme heat. Use caution with sharp objects. I'm sensing a theme here. Beware of hot coffee, pots and pans and water. You might not feel the heat until you've been burned. If you feel unsteady on your feet, be careful on stairs or in the shower. Some of this is common sense, guys. Consider moving area rugs so you don't trip. Consider putting non-slip bath mats in your tub and shower. For want of adhesive ducts. If y'all watch The Big Bang Theory. Okay, the next problem. Nausea or vomiting. Eat small, frequent meals and bland food like bananas, rice, applesauce, or toast. Eat food cold or at room temperature to minimize the smells. Do not eat fried, spicy, or fatty foods, and drink plenty of liquids. Diarrhea. So on one of the cancer things, like I said, there's a couple funny people. Most people aren't, but there's a couple funny people. And somebody posted the other day, never trust a fart. No joke. Apparently when you're on chemo, never trust a fart. And a lot of people like chimed in with, yeah, and it's not a bad idea to buy some Depends and have them in your chemo bag. So my question is, does it affect the sphincter? Like, I don't know. Just squeeze the cheeks. I don't know. Anyway. Do not take laxatives or stool softeners if you have diarrhea. That's written here. Okay, I'm going to tell you a little fun side note just because I'm super ADD. So I remember years ago, my friend Robbie and I went to Weight Watchers. I hope she doesn't get mad for saying that on my blog, but we did. And we went to a meeting, and the lady asked, she's up in the front of the meeting and she's talking to the group, and she says, what is a clear liquid with little to no calories that you can drink? And I'm like, boom, me. Nobody else raised their hand. I'm like, y'all dumb. So she looks at me, a kind of pained expression on her face, and she was like, yes. And I was like, vodka. I really thought I had it right because she said little to no calories. She didn't say 0 calories. She said little to no. I thought I nailed it with vodka. Some people laughed. Most people were miffed. She was miffed. Life with Erlene. So yeah, this, whereas on diarrhea, it says drink 8 to 10 glasses of clear liquids a day. My brain goes, vodka. I'm not going to drink when I'm on chemo, so everybody calm down. But my brain will always go to vodka when you're talking about clear liquids. Mouth sores and pain are next on the list. Brush your teeth 2 to 4 times a day with a soft bristle brush and fluoride toothpaste. Eat soft or pureed foods. Do not eat foods that are acidic, spicy, salty, rough, or dry. Sit down and eat. Baby food. That's what you get. Sip water during the day. You've already told us in everything else that you need to drink a whole lot. Sip water through the day. Okay. Okay. The next one. Fluid retention edema. Check your weight often. Try not to eat salty food. If your feet are swollen, put them up or go for a walk. 2 very different things to do. Okie dokie. Next on the list of side effects, hair loss. We know this. Use a soft hairbrush. Do not get a perm. Do not color your hair. Do not wash your hair every day. Use a mild shampoo when you do. Do not use a hair dryer. If you do, use it on a low setting. If you choose to shave your head, use an electric shaver to avoid cutting your scalp. Some insurance covers wigs. Use sunscreen or wear a hat or scarf to protect your scalp from the sun. Y'all, I'm not getting a wig. I think I would look weird AF with a wig. And I don't, and they're itchy, they're heavy. I don't like my hair that much. I don't need a wig. I will wear a hat. I already wear a hat in the sun, so that's no prob, Bob. Rash, itchy skin, or other skin changes. Do not stay in the heat for long periods of time. Use creams or moisturizers often and try to wear cotton gloves. Do not use perfume, cologne, or aftershave. These products can irritate the skin. Try to stay out of direct sunlight and do not use tanning beds. Why do these things have to be written here? Humans, I worry about you. Wear protective clothing, a hat, sunglasses, and sunscreen with SPF 30 or higher when outside during treatment. Nail changes may include darkening, brittleness, vertical or horizontal bands of the nails, or infection of skin around the nails. Trim nails often and keep them clean. Wear gloves for cleaning and gardening to prevent infection. Keep hands out of water or use waterproof gloves when doing wet work. I mean, you should always wear gloves when you're doing wet work. Use antibacterial soaps and apply lotion after washing hands. Avoid wearing nail polish or false fingernails until the nails have returned to normal. And then less common, those are the common ones. The less common ones is appetite loss and joint or muscle pain. Other possible: abdominal pain or constipation, changes in taste, flu-like symptoms, headache or dizziness, trouble sleeping, pain, swelling, or redness at the injection site. Side effects listed as common, which were all the major ones that I just read to you and kind of what they wrote about them, occur in more than 25% of patients. The less common ones, the appetite and the muscle and joint pain, occur to 10 to 25% of patients. And the other ones listed as other possible side effects are notable, but less frequent. Side effects may vary in how they occur with different uses and dosing. I feel like this is all so much common sense. This treatment can also cause serious side effects, including allergic reaction, kidney problems, liver problems, heart problems, lung problems, eye problems, hearing problems, alcohol exposure, some types of docetaxel, I don't know, one of the medicines, contain alcohol and can cause intoxication. If you receive a type of docetaxel that contains alcohol, use caution when driving or operating machinery. Tumor lysis syndrome, TLS. Doesn't say what it is. It must have something to do with your kidneys. Because it says if you have trouble urinating, let somebody know right away. Swelling or infection of the intestines. Severe skin toxicities. Tell your provider right away if you have swelling around the eyes, a severe rash, or rash that looks like pimples or blisters on the skin, in the mouth, or on the genitals. Electrolyte changes, secondary cancers. This treatment can cause certain types of cancer years after treatment. Talk with your provider about your risk of other cancers. Oh, and then there's a whole thing about pregnancy and breastfeeding. Don't have to worry about that. And then the last page. When should I contact my healthcare provider? Fever over 100.4, unusual bleeding, nausea or vomiting that is severe and uncontrolled with medication or lasts for several hours, diarrhea that causes an extra 4 bowel movements a day, lasts more than a day, or diarrhea with a fever, cramps, or bloody stools, constipation that lasts more than 2 to 3 days, with stomach pain. Apparently, if you don't poop for a few days, it's fine, as long as you don't have pain. Problems urinating, blood in the urine, dizziness, lightheadedness, severe headaches, confusion or vision changes, paralysis on one side of the face or body, pain, swelling or redness in the arms or legs, shortness of breath or cough, chest pain, tightness, irregular rapid heartbeat, fluid retention that causes sudden weight gain or swelling of the stomach, hands or feet, rash with itching, trouble breathing, swelling of the lips, throat, or tongue. Yeah. If you're having anaphylaxis, call your doctor. Severe pain, skin blisters, swelling of the hands or feet, mouth sores or sore throat or mouth, redness, swelling, or pus at treatment injection site around any tube, such as an implanted port. Flu-like symptoms. Any new pain or uncontrolled pain, changes in mood, depressions, or thoughts of suicide. That concludes section 1 of the book, of the cancer book. We will go over the rest of this book, because I, like I said, haven't even really gotten over it. What I'm looking at right now is just a thing about Texas Oncology, the care team, who to call, when to call, blah, blah, blah. And then there's a section, what is cancer? It tells you all about cancer, coping with cancer. All right, we will go over this once I have a chance to look at it. I just went over that first little thing that I went over with you. And I thought it was a lot. It was also somewhat funny. And funny, because it's funny, but also a little bit sad that some of this has to be written. Kind of like cruise control is not autopilot. Please don't step away from the steering wheel of your RV when you set cruise control. You still must drive the vehicle. Or don't curl your hair in the bathtub. You know, things like that. So, humans, let's do a little better with common sense. Just in general. I think that would just kind of help the world at large. A little more common sense. And then as far as everything goes, they have to put that stuff in there. And I'm sure that happens. I know that it happens. I have had lots of friends that have gone through cancer, and yes, it happens. Whatever. It's not like I can't do it. I mean, I guess I don't have to, but I kind of want to live. So we're going to do it, and we're going to go through it. And, I mean, there's a lot of sayings and songs when you're going through hell, keep going. So we're just going to keep on trucking. We might have a little puke bag. We're just going to keep on trucking. No other way to go. All right. Well, I hope you guys got a kick out of that as much as I did. And now that that's over, and now that we've done all the pre-op, I don't have any doctor's appointments until we get back from the horse show. So the rest of my time is full focus, 100% on the horse show and getting ready and everything else. And I'm really excited. The rain has not been as bad, so we've been able to work horses. I'm going to hang up with you guys, put on my riding clothes and head to the barn and work those 2 horses. And then I've got lessons this evening, and tomorrow we're going to do lessons, work horses, and finish packing. I'm so excited. We're going to a horse show. So I will talk to you guys soon, but the next couple of posts are probably all going to be horse related. I'm so excited about it. All right, I'll talk to you guys soon. Bye.